thank you guys for joining me. We have a great group on here today, and I'm very, very excited to dive into alpha hydroxy acids. So I know this is a category that we learn a lot about in school, but even as a licensed esthetician myself, I am constantly learning more and more about alpha hydroxy acids and their overall benefits and how we can use them and incorporate them into our client's skincare regimen and why they're important to incorporate into a skincare regimen. So I'm very, very excited to be able to share some additional information with you guys today on alpha hydroxy acids. And for those of you who don't know who I am, I just want to do a brief introduction. I'm Danielle Rosil with ClarityRx. I am a licensed esthetician. I practiced for many years before moving and transitioning more into the education side of things. I'm truly, truly passionate about training and education to help to build and grow confidence for you as the estheticians, because that confidence will then carry through when you're speaking to your clients, and you'll be able to provide the best treatment options for your clients. So today is all about alpha hydroxy acids. And for our just kind of reminder within our brand, for anybody who may be newer to Clarity, our products are plant-based, yet very much results-driven. So we are, and you'll notice time and time again that we really highlight and focus on the clinical outcomes or the results for your clients. Our clients are coming to see us to be able to see that change and that improvement in their skin. And more often, they're wanting to do it in more of a clean, kind of natural way. So all of our products are derived and plant-based. We have very few ingredients in a lot of our products. So the beauty is in the simplicity of our products. And within our alpha hydroxy acid family, you will see just that. So we do have a 6 steps into achieving healthy skin. So we have our cleanse and exfoliate step. Then we have correct. So our correct category is going to be divided up into 2 different sections. So that's going to be our acid-based correctors and then our serum-based correctors. Today, we are going to be talking a lot about the acid-based correctors. And then we have our hydrate step. So this is, think of your water for the skin. And then we have our lubricate step. This is going to be your lipids and your emollients to be able to help to trap in that water content within the skin. Then nothing else matters if we are not protecting our skin from UV rays, UV damage, provide added antioxidant protection. So we have our 2 broad spectrum SPF choices. So our skin defense and our physical skin defense. And then last but not least are our masks. So we have 7 different results-driven treatment masks to be able to really hone in and correct the skin care. All right, so we have, all today, we are going to be focusing on our acid-based correctors. More specifically, so I have Fix It up here, but more specifically our Fix It, Brighten It, and Restore It. So we have, for our alpha hydroxy acids, we're focusing on Brighten It and Restore It. I just don't want to leave out Fix It on a few minor pieces, so you will see that brought up more towards the end of the webinar here. But for today, it's all about our alpha hydroxy acids. So what are alpha hydroxy acids? And there's chemistry was never really a strong suit of mine. So I do kind of chuckle that I speak a lot about ingredients and mechanism of action. And if you would have told me that in high school, I would be talking about this and I would get excited about it, I would laugh at you. But now I truly am excited because I'm able to actually apply it day in and day out and be able to see the benefits. But so your alpha hydroxy acids, you will see some, different structural of what that molecule looks like. But I think in the simplest terms and what we really need to know and what our clients care about is alpha hydroxy acids are the most fundamental ingredient. So alpha hydroxy acids are pretty much found everywhere. So they can be found in nature as well as them being naturally within our body. So citric acid and lactic acid, for example, can be naturally found within our body. So when we're looking at skincare and applying it, now we're not adding any sort of excess stress or uncertainty into the skin because our bodies already can recognize some of these ingredients. So our lactic acid, it knows exactly what to do with it. It recognizes it, and it's not, unsure of what this exact molecule is and how to utilize that specific molecule. So benefits of, and this is just alpha hydroxy acids as a whole. So we'll talk about the different types here in a minute, but all encompassing alpha hydroxy acids as a family. They are in our chemical exfoliation classification. So as we know, we have your enzymatic exfoliation, like your pumpkin, your bromelain, your, papaya enzymes, lots of different fruit enzymes. Those are going to exfoliate the skin more on a very superficial level. Then we have your mechanical exfoliation. So that's going to be your facial scrubs, your washcloths, your brushes. That's actually physically knocking off dead skin cells. Then we go into our chemical exfoliation family, are alpha hydroxy acids. So the cool thing with alpha hydroxy acids and chemical exfoliation is not only is it exfoliating the skin, so it's ridding the skin of dead skin cells, loosening up the bonds or the desmosomes to increase that exfoliation, but it also has added benefits to it. So, and there's a laundry list of added benefits. For alpha hydroxy acids specifically, as a family, they will promote collagen production. They will help to correct discoloration. They will improve the appearance of fine lines and wrinkles. How is it doing that? By stimulating and promoting that collagen and elastin production. They can help prevent acne breakouts. It will provide just overall brightening to the complexion. So sometimes there's a little bit of gray line, when you're treating discoloration versus brightening. Brightening is just restoring that lumosity within the skin, having that nice, healthy glow. When you're correcting that discoloration, now we're targeting the melanocyte and any sort of hyperpigmentation that might be within the skin as a result of maybe trauma, so your post-inflammatory, melasma from hormonally induced pigment, or UV pigmentation. So alpha hydroxy acid in the family will target all three types of discoloration as well as brighten the overall complexion. So it's brightening the complexion by increasing that cell turnover. As we age, our cell turnover slows down. It will create more of a dull, kind of ruddy appearance on the skin. By exfoliating with these alpha hydroxy acids, it's going to bring the skin back to life and restore that brightness and that exuberance within the skin itself. And at the end of the day, they also help whatever else you are using to work that much better. So if you're using Get Fit peptide serum because you're targeting fine lines and wrinkles, incorporate an alpha hydroxy acid in there to ensure that those peptides aren't just sitting on a layer of dead skin cells. exfoliate off those dead skin cells. So now the Get Fit and those peptides are able to penetrate much deeper and work more effectively. Pigmentation, let there be light. So everything will work just a little bit better by gently exfoliating and gradually incorporating alpha hydroxy acids in your client's daily regimen and also what you're doing in the treatment room. And I did steal this quote from the Rogue Pharmacist. So I know Veronica had posted in the group a podcast on alpha hydroxy acids, and I took so much valuable information from there, but there was one quote that the Rogue Pharmacist said that really resonated with me. And it's something that we can share with our clients is the human body is designed to thrive under stress and resistance. So in order to create change, there has to be a little bit of stress in the body in general. So think about building muscles. You're working out, you're sore, you're stressing those muscles. So now they can go in and they can repair, rebuild, and get even stronger. So your alpha hydroxy acids are creating a controlled kind of stress within the skin. So that way it can go in, can repair itself, build extra collagen and elastin, really firm up that dermal layer to provide the added necessary support for our epidermis. If you haven't listened to that podcast, I highly, highly recommend it. There's a lot of great information in there. So thanks, Veronica, for sharing that with all of us. So here is, for those who want to geek out on the molecule and the shape of our alpha hydroxy acid. So this is the alpha hydroxy acid family. So you have your citric acid, mandelic acid, lactic acid, glycolic acid, tartaric acid, and malic acid. For today, we're really going to dive in deeper on your lactic acid and your glycolic acid. So here, just looking at the family as a whole. So they all are very encompassing and will target a multitude of concerns and conditions. And it's one of those things where, okay, when do I recommend that somebody uses glycolic acid? When do I recommend that somebody's using lactic acid? What's the difference between these? I know they're all under the same family, but there's a little bit of differences and variations within this family of chemical exfoliants. So looking at it as a whole, your glycolic acid has a very small molecular weight. So what that means is it actually penetrates the skin much faster, and it can penetrate the skin a lot deeper. Then you have your malic acid. So malic acid has some humectant properties to it. It has some antioxidant benefits. Same with tartaric acid. So tartaric acid's from grapes. You have some antioxidant benefits. Mandelic acid is a very large molecule, similar to lactic acid. So that just means that they have a much slower absorption rate. They have next to very, very low kind of irritation that can happen with these because of that large molecule size. Then you have citric acid. So citric acid, as I mentioned, this is found kind of naturally within the body. This also plays a role into just a natural body kind of system and biochemical pathway within our body. It's part of the Krebs cycle. So I'm not going to dive into the Krebs cycle, but that just shows how much that some of these alpha hydroxy acids are intertwined with our bodies and are really responsible for a lot of different biochemical pathways within the body. Then you have, last but not least, our lactic acid. It's a large molecular weight and it's very, very hydrating. All right, so let's go into a little bit more on glycolic acid specifically. So glycolic acid, here is what that chemical compound looks like. It is very small, as I already mentioned, and it can be found naturally within sugarcane. greater penetration ability. So this is what makes the product, or this specific ingredient, great for more of your congested, kind of closed comedones. So there's not necessarily inflammation involved, but it's able to go in deeper. It has more of that, it's going to reduce the corneocyte cohesion and that corneum thickening. So basically, very simple words, it's helping to thin out the areas of the skin, so your stratum corneum where you don't want it to be thickened, but over time can thicken, just for that decrease of cell turnover, by helping to exfoliate and loosen up the desmosomes. So the desmosomes is that glue-like structure holding our dead skin cells together and to the surface of the skin. So glycolic acid with that small molecule, deeper penetration, it will help to dissolve and reduce that corneocyte cohesion, allowing for the skin to, that dead skin to slough off. For your, comedones with the acne, non-inflammatory acne, it dissolves that intercellular cement. So again, your desmosomes, for abnormal keratinization. It will also boost collagen production. So what it's doing is it's actually signaling our fibroblasts to then go in and to start to produce collagen and elastin, which is why glycolic acid is targeted and will help to treat aging skin as well as more photo damaged skin. Now, something to keep in mind, I think when we're looking at alpha hydroxy acids as a whole, we think our lactic acid is the only thing that will provide some hydration. Now, yes, it's true that lactic acid has a much more powerful hydration. It's a lot more gentle on the skin, but glycolic acid will help to boost moisture retention as well in the skin. So for skin types and skin conditions, recommending it, again, aging skin, helping with that collagen and elastin production, non-inflammatory acne, looking for normal to resilient skin. And it is appropriate for Fitzpatrick 1 through 6. So nowadays, we want to make sure that we're treating the skin appropriately. So this is an exfoliant that can be used regardless on the lightest skin and the darkest skin very, very safely. So it's a very versatile treatment option for your clients. Next up, we have lactic acid. So you can see here with the molecule, it is larger, just visually speaking, when you are comparing it to glycolic acid. Now, lactic acid is naturally found in sour milk, and it is also naturally within the body. So this is something that you can't really be allergic to. In the case if somebody is lactose intolerant, this is very, very different with that topical application, because we do have lactic acid floating around in our body and in our muscle tissue. It is actually a byproduct of energy that's happening. So it's part of, again, going back to that working out, you work out way too hard, your muscles are really sore. That's a buildup of lactic acid within your muscles. So it's actually a product of the metabolism of glucose and glycogen. So don't necessarily need to know that specifically when it comes to skincare, but I do think that it's nice to have some of that background knowledge and information of this is very gentle on the skin. It's very gentle in the body. Will there ever be a vegan safe lactic acid version available? Because of our kind of plant base, I don't want to say never, but with lactic acid just naturally being found in sour milk, that is kind of where we are kind of targeting as of now. Great question. This is also a component of our skin's natural moisturizing factor. As we age, our natural moisturizing factor starts to break down. We start to lose our hyaluronic acid content. We start to lose a little bit of that lactic acid. So we're able to then topically apply the lactic acid, and our skin recognizes it and knows exactly how to use it. Also very interesting and kind of a nice fact is there are studies that indicate that lactic acid actually has the ability to increase water retention capacity within that stratum corneum. So by adding lactic acid into your client's daily regimen, especially for your dry skin clients, it's not only exfoliating, allowing for your other hydrating, maybe daily dose of water or your moisturizer to really work to its maximum potential. The ingredient itself, lactic acid, is going to increase that water retention and help with adding hydration into the skin. And if it doesn't do enough already, another added benefit in there is it will suppress the formation of tyrosinase. So that's why it is fantastic for your hyperpigmentation, all three types, because it is suppressing that overactivity within the melanocyte. So increasing the exfoliation, allowing for those pigmented cells to slough off easier, while simultaneously helping to reduce that overactivity of the melanocyte. Who is lactic acid good for? Honestly, it was a little bit of a struggle to really highlight specific skin types and focus, because really there is not a single person that lactic acid isn't appropriate for. So aging skin, think of more of your dryness. It will stimulate that collagen and elastin production. Discoloration, we already talked about that. Dry, more sensitive skin. Your rosacea skin clients know, yes, we can't diagnose rosacea, but if they are showing signs of rosacea, or maybe you know that your client has been diagnosed with rosacea, that skin type still needs to be exfoliated too. We just need to do it in a gentle way. Mechanical exfoliation isn't necessarily the best option for rosacea. Moving into Brighten It, your lactic acid solution, this would be fantastic to be able to increase that cell turnover, but still very, very gentle. And again, appropriate for Fitzpatrick's 1 through 6. Compromised barrier. So the first line of defense, we want to make sure that we are repairing that barrier function for that client. And it doesn't take long to be able to repair that barrier. So I would recommend having them use Nourish Your Skin for even a week, a very gentle cleanser, and nourish your skin for a week. Repair that barrier function, and then lactic acid would be the first kind of spot that I would dive into, and I would use the Brighten It versus necessarily going directly into the 15% lactic acid chemical peel. But Nourish Your Skin is a fantastic product at helping to repair and restore that barrier function. All right, so our alpha hydroxy acids, we have them available both in the treatment room as well as at home, and they pair great together because we want to keep these active ingredients in their skin. We don't necessarily, if we only see our client every 6 weeks, we're losing that opportunity to be able to have these beneficial alpha hydroxy acids in their regimen at home. So we already dove into kind of what glycolic acid is, the benefits of glycolic acid, just a nice visual here. Our glycolic acid-based home treatment is Restore It. So very, very clean ingredient-wise. All that's in this product is 7.5% glycolic acid and water. Then we have Brighten It. All that's in Brighten It is 10% lactic acid and water. This is great, again, for discolored, dull, rough textured skin. This can be used at home for your clients, and we'll talk application. So that's a big question that comes up, is how do I use these products. So they come in a nice, beautiful glass bottle, as you can see here. And there's a couple ways that we can apply it that are very, very simple. So it's going to be for nighttime use only. These alpha hydroxy acids, they will make you more photosensitive, and they will, your skin's in repair mode and recovery mode at night. So it's great to have these regenerative kind of stimulating. Remember, we're adding a little bit of stress onto the skin to be able to trigger it to repair itself in a very controlled, gentle way. And doing that at night when our body's already in repair mode is the best option. So you will apply this either with a cotton ball, a cotton pad, even a circular cotton kind of makeup remover that you can get at Target or Walmart, Walgreens, anything like that. So you'll put the cotton pad directly on the neck of the product, of the bottle. You'll saturate the, let's just say cotton ball. You'll saturate the cotton ball. You can do, over and back, I would say 2 to 3 times is enough of the solution to be able to cover the entire face. And then your client will use it more of like an astringent in there. So just wiping it across their full face. They will leave it on. So they don't need to worry about, like you guys need to do in the treatment room, setting a timer and removing it. They will leave these solutions on. So in a daily regimen, they'll cleanse, they'll apply the appropriate, whether it's brighten it, restore it, or fix it. They will apply that solution to their skin, leave it on. Then they'll proceed with adding their corrective serums, then their moisturizer, and then they can go to bed. Start off slow with these and introduce it. So if you need to start 1 time a week, start 1 time a week. We just don't want to necessarily use them more than 3 times per week. These are very active and potent solutions. Can these be used on teens? So that's where there's no, we want to treat the skin in the state that it's in. So as long as they are, you have their guardian approval, and they aren't allergic to anything, and there's not any outstanding, concerns. If somebody needs to use it and they're in like their teens, there's nothing wrong with being able to use any of these at-home solutions. Again, it's just getting the approval from their guardian too on that. All right, then we have our pick-me-up pads. So these are a combination of your alpha hydroxy acids and your beta hydroxy acids. So your AHA, BHA, it's got your salicylic acid in there, and then it also has your glycolic acid in there. So that's where your AHA, BHA is coming from. These are, these are great for more of your acne problematic skin. You can even use this on somebody who has more of that thick, resilient, photo damaged skin. The nice thing with this is that it's almost like your lazy client product because it's already pre-saturated. Not that using a cotton ball or cotton round onto the neck of your fix it, brighten it, restore it takes long. It really doesn't. It takes like 2 seconds. But for those clients that tell you, you're lucky if I wash my face, I need something quick and easy, full treatment, the pick-me-up pads are a great solution because they're already pre-soaked pads, and there comes 50 of them in a jar. So that's another wonderful option for an at-home exfoliant, and this does have the combination of the alpha and beta hydroxy acids. You'll use these very, very similarly as your fix it, brighten it, and restore it. You'll apply these once per week at home. If your client can tolerate more, it just might take a little bit longer because it is a higher concentration, just more potent, with a combination of your AHA and your BHA in one pad. They can gradually increase that frequency. Again, I would not recommend using it any more than 2 to 3 times per week. So that is going to be the same. Then we have Another AHA BHA combo is going to be our Clearzit. So Clearzit is going to, we have a couple, actually I have a derm that I like to call this the Zit Zapper, because it really targeted and hones in on those specific acne lesions. It's a great product that you can keep in your purse, apply on the go, as you're out and about. You know how you always like, oh gosh, I can feel one just coming underneath the skin. I want to treat it right away. Look no further than your Clearzit. I don't leave home without this. I have it in my purse, and I also have it in a travel bag too. So if I ever feel an acne breakout coming up, I will pull out my Clearzit and I'll immediately target it. So it's got your salicylic acid and your glycolic acid, in addition to witch hazel. So witch hazel is very, very calming, has relieving inflammation, reduces that irritation. And we know with acne breakouts, there is an inflammatory component on there. So the tip of the applicator is antimicrobial, antibacterial, so you don't have to worry about any sort of bacteria growing or being present in that. You can apply this as needed. So I would say, you know, you can apply it multiple times throughout the day. I just wouldn't necessarily recommend applying it more than, I would say, 3 to 4 times per day. As a society, I know I'm guilty of this as well. I put the Clearzit on and I want my acne breakout to be gone right away. Well, it doesn't necessarily mean if I apply it 35 more times that day that it's going to automatically disappear. So we have to allow these active ingredients to really work within the skin. So it's not necessary to apply it more than, I would say, 3 to 4 times per day in there. So again, allow those acids time to be able to go in there, fight that bacteria, exfoliate. It doesn't happen overnight. I know we feel like these blemishes just pop up out of nowhere, but under the skin, they've been brewing for a little bit. So we also need to be patient in the treatment with that too. All right, so just a few tips from the professionals. So there's a lot of different ways that we can utilize our alpha hydroxy acids in the treatment room paired with at home. And what I mean by a lot of different ways of using them is more so different combinations. So the kind of most straightforward way, if you have somebody coming in and receiving a chemical peel, so they're receiving the glycolic acid peel, they're targeting fine lines and wrinkles, they have resilient photo damaged skin. Then in between your treatments, you can send, and we recommend you send your client home with Restore It. This is their lesser, lower strength chemical peel treatment to use at home in between their visits. So you're using the same exact, it's apples to apples. You have your 15% in the treatment room, then you have your 7.5% that your client's going to go home with to use in between their time from seeing you. It's a lower strength, so it is appropriate for them for home use, and then they come to see you for your professional strength chemical peel with a glycolic acid exfoliator. If you want to reverse that, say somebody, they've never had a peel done before, they're a little bit nervous, start them on Restore It at home. Have them use it once a week. It's 7.5% versus your 15%. Allow them to build up that tolerance to the exfoliant itself, get used to it. It's more so prepping and priming the skin. Then after, a couple weeks of doing that, maybe a month of doing that, have them come in and their skin is prepped and ready to go for the glycolic acid 15% chemical peel. Yes, glycolic peel is a great option for acne, especially when you're looking at your non-inflammatory acne. So think of your grade 1 acne, your closed comedones, some open comedones. There's no inflammation. There's no bacteria present. Glycolic acid is a great treatment option for that, both preventative and corrective. When you're looking at more of your inflammatory acne, salicylic acid is going to be a better option for them. Yes, this will be recorded, so you can play it back. The other thing is more of that 360 approach from mixing it up. So maybe a lot of times people come in with a combination of skin concerns and skin issues. It's not just I'm concerned with aging. Maybe it's aging and discoloration. So this is an opportunity to be able to say, okay, your primary concern, maybe it's fine lines and wrinkles, but you do want to brighten and work on a couple, discoloration areas within the skin. So I'm going to focus in the treatment room, knowing that glycolic acid will help to brighten the skin just by sheer exfoliation. In the treatment room, I'm going to do a glycolic acid chemical peel, but in between our visits, I'm going to have you start using Brighten It. So now we're targeting both concerns simultaneously, and we're able to mix and match. Now, I just want to clarify, this is not mixing and matching in the treatment room. Our peels are standalone, used by themselves, but by mixing and matching, I mean, use glycolic acid chemical peel in the treatment room and then send them home with a different exfoliating or alpha hydroxy acid like Brighten It to use at home in between your visits. Mix it up a little bit. Maybe your client has, they want to have some brightness. They also want to target, they have thick, photo damage resilient skin. Don't be afraid to necessarily have them alternate. So maybe their skin can tolerate an alpha hydroxy acid twice a week. It's okay to say, all right, on, Wednesday nights, use Brighten It. On Sunday nights, I'm going to have you use your Pick Me Up pads. So you're able to introduce and kind of mix up those alpha hydroxy acids when they're using them at home. I wouldn't recommend combining these. So don't use your Pick Me Up pads and then put Brighten It on top of it. We want to find that balance. Yes, we want to create a little bit of change and stress on the skin to be able to improve the health, but we need to do it in a controlled, kind of easy manner and not over exfoliate the skin. But you can definitely mix and match these. If they're using them 2 to 3 times per week, you can say, use this alpha hydroxy acid this day and use the other alpha hydroxy acid on another day. Correct. So after, I would say 3 to 5 days after a chemical peel. So once that skin has resumed and is back to baseline, then they can go, which is usually 3 to 5 days. Then they can go ahead and go back to their normal regimen, which could include would include their alpha hydroxy acid. Combination treatment. So at home only. So again, exfoliating at home, you can, target treat. Think of your multi-masking. You can multi-alpha hydroxy acid exfoliate. So maybe somebody is very, very congested. They have some comedones and all that in their T-zone. You can use your Restore It. But the rest of their face is like their cheeks are really dry. Then go ahead and you can apply Brighten It to the cheeks. So have them do the center part of their face with Restore It, and then they can do the perimeter or the cheeks with Brighten It. They can absolutely do that. Just bear in mind, this is going to be the perfect client. So perfect, I mean a very compliant, one that follows instructions really well and doesn't like to necessarily go rogue. So please choose this appropriately. It's not for everybody, but there are other options. So if somebody has melasma, and maybe the melasma is only in the center part of their forehead, and then they want to target more of those fine lines and wrinkles and some, congestion, they could do Brighten It just on their forehead and then do Restore It on the rest of their face. You could also spot treat with your Clearzit and then use another alpha hydroxy acid from there. Don't forget hydration. That's really important. So when we're exfoliating the skin, we're taking things out. So that's speeding up that cell turnover. It can, although in long-term things, lactic acid, glycolic acid, they'll help with hydration. But in the immediate time post-treatment and days following, especially introducing an alpha hydroxy acid, we want to make sure that we are adding back to the skin and adding that appropriate hydration. So the Call Me in the Morning is probably the most versatile option to add in and send your client home with one of the actually any of them. So Pick Me Up pads, Brighten It, Restore It, Fix It, because it's very calming, anti-inflammatory, has antioxidant benefits. So that would be kind of the first choice. The more you know your clients and their skin conditions and their goals, then any of the other moisturizers that will be targeted are appropriate. We just want to make sure that we're adding that hydration in and we're not over treating, over disrupting that barrier, but we're putting back things that we're taking out. So facial oils, Glimmer of Hope, nourish your skin, even Get Balanced, especially for more of your acne prone clients, kind of your clients that have maybe a little bit more of an impaired barrier that we're working on. Get Balanced is a great way to strengthen that skin and strengthen the skin's microbiome, in addition to, say, Brighten It. So hydration, hydration, hydration in combination with your alpha hydroxy acids. Now, I'm sure you guys have seen this many times. Just a refresher if you have not. For January, we are doing a Sellin promotion all around our take-home acids. So that's going to include Brighten It, Fix It, and Restore It. So for the sell through option, again, hydration is important. So for your client, anybody who purchases a glycolic, Fix It, or Restore It, they will receive a deluxe travel size. So this will last about a week, if not a little bit more, as long as they're using just a pea size, not overusing it. They'll go home with a deluxe travel size of Call Me in the Morning. So they're getting that added hydration and really rounding out that treatment approach. Return to Calm for post-peel. So it is anti-inflammatory. So it's going to calm some of that inflammation. Sometimes you might need a little bit more hydration in the skin, but there's nothing in there that would cause any sort of irritation or inflammation in the skin with the CBD. We always recommend just keeping it clean and simple with that post-procedure kit. So very gentle cleanser, antioxidant, have a sunscreen. But if they want to use like their Return to Calm moisturizer after, there's really no reason why they wouldn't be able to do that. All right, so excited to take this moment to introduce our February sales contest. So this goes hand in hand with our Sellin promotion that's going on this month, starting February 1st. So February 1st through February 28th, we are focusing all on our acid-based correctors. So for the top 10 estheticians that sell the most acid-based correctors, as a reminder, I know today's webinar was all about our alpha hydroxy acids, Restore It and Brighten It. For the sales contest, it's going to expand across all of our acid-based correctors. So you have your Restore It and your Brighten It. Then you have your Fix It, you have Pick Me Up pads, as well as Clearzit. So for the top 10 estheticians that sell the most of that family of products, they will receive their choice of Clarity products. So for the grand prize, first place, you will win $1,000 of your choice in Clarity products. Second place, $900, and it goes down, and the 10th place winner will receive $100 in their choice of Clarity RX products. Then we also have, so that's for the individual contest. Then we also have the spa cohort contest. So for each esthetician in the spa, within each cohort that has the highest total sales in the acid-based corrector category, will receive a deluxe travel size of Brighten It, Fix It, and Restore It, and a retail size of Take It Easy. So 2 components, lots of fantastic prizes, $1,000. Just think of all of the wonderful Clarity products that you can have if winning with $1,000. And again, it is your choice. So it's not us deciding, it's what products do you want from Clarity as the winner. So reminder, this is February 1st through February 28th. Make sure your shelves are stocked and ready to go. I feel like this is going to be a really tight and great competition, ready to see you guys really crush this. Take advantage of the Sellin promotion that's going on this month, all around your Brighten It, Restore It, and Fix It, and receive those deluxe travel sizes complimentary. Some exciting new marketing pieces have been introduced as well. So Jacqueline has created and team has created these beautiful new marketing pieces. We have the Dynamic Duo, so detoxify, it's the Clarity Salicylic Acid Peel and Blue Light Therapy. And then we have both for male and female versions of it, as you see here. So very eye-catching. I love the name Dynamic Duo. Really does encompass the power and efficacy of those 2 combinations. These marketing pieces are available. So your owner can get them they can get them on Allcom for window posters, which also have a QR code for clients to book online. And then there are counter cards and social media images that can be accessed on FranConnect. Again, your owners will be able to have access to these and be able to get these up and positioned in your spas. All right, well, thank you guys. Looks like we have, yes, so these slides will be available for future reference. We have recorded this session. So we will be sharing this, Jacqueline will be sharing this in the newsletter along with the handout of the slide deck. So thank you all very, very much for your time. I hope you learned a lot. If you have any questions at all, please do not hesitate to reach out to us, your customer success specialist, or myself, and we are here and happy to help. Thank you again for joining. Have a wonderful rest of your day.